Okay, we're recording. Thank you.
Wonderful. Hello, everyone. My name is Gill Adynski, and I am coming to you all from the International Council of Nurses. I'm very happy to be here speaking with you today on our position statements on health and climate change. We do a lot of work on this subject, and I'm excited to share it with you. For those of you that don't know, I'm going to start with a little introduction about who ICN is and what we do. We are a federation of over 140 national nursing associations, and we were founded in 1899, and we today are the voice of the 30 million nurses worldwide. Our mission is to represent nursing worldwide, to advance the nursing profession, and to promote the well-being of nurses in all policies, and that includes in climate and planetary health policies. Our current president was just elected in 2025, Jose Luis. He made his word empowerment, meaning for the next 4 years, our goal is to focus on the empowerment of each and every nurse. And in the space of climate change, that means empowering every nurse to do what they can to make our planet and environment a little bit better. These is a picture of our board members from 2025 to 2029 who was just elected. Since you are all from the Latin America region, you can take note of Dr. Nora, who is your board member. ICN does a work on a lot of different areas pertaining to nursing workforce, um, code of ethics, mental health, and primary health care. I wanted to give you this overview of recent reports we had came out. While none of these specifically relate to climate change, all of them intersect with climate change. Specifically, the Code of Ethics, as we call all nurses to not just protect the individual patient, but to protect the larger environments as well. I also want you to check out our new nursing and nurse definition. Part of understanding who we are as nurses is uniting under one definition, and that definition goes beyond bedside and clinical nursing, but calls nursing as a profession that is meant to heal the world and be a part of humanity. So it's about working in policy spaces and spaces of leadership as well as at the bedside, and that's what you're all doing here today with your commitment to climate change. Two other reports I would encourage you to take a look at after this is our State of the World's Nursing Report that we worked on with the World Health Organization. A really important part of this report is that we're making progress in putting nurses into leadership roles, but we haven't yet reached that. Nurses continue to be undervalued and underprotected. We know that this is particularly important with climate change efforts, as nurses are on the front lines of climate change and climate disasters. Furthermore, we need nurses valued in climate spaces so that they can be part of the leadership to change and make better climate policies. The WHO's strategic directions for nursing and midwifery call for nurses to lead in education, leadership, jobs, and service delivery. We need to embed climate policies in each one of these WHO initiatives. So because we are aligned with these global nursing priorities, that is why ICN is so focused on climate change and planetary health as a core issue in our program of research and initiatives. Climate and health crisis. Every nurse is already seeing the effects of climate change. Because of that, ICN has launched two important documents within the last 2 years that I'm going to talk to you about today. The first is a position statement on climate change and health, and the second is a topic brief on planetary health. As many of you already know, since you're experts in climate change, planetary health is a subject that heavily overlaps with climate change, but goes beyond it and looks at the importance of taking care of our environment in general. When I was at the United Nations for my work at ICN last year for the Pact for the Future event, This was a core theme in the Pact for the Future document. Our challenges are deeply interconnected and far exceed the capacity of any single state alone. They can only be addressed collectively through strong and sustained international cooperation guided by trust and solidarity for the benefit of all. I wanted to open with this quote today because this is the spirit of what we're doing. As I just talked to you all about, you're united across many different nations for the shared purpose of shared climate advocacy. As we look at these position statements, I want you to look at them through a lens of asking yourself, what can we do together to advance climate change? Because none of us alone are able to take on these challenges. The first of the two ICN documents I'm going to talk to you about today is the Nursing Climate Change and Health Position Statement. As you all likely already know, climate change is the single greatest health threat of our time, and it worsens global health inequalities. It causes extreme disasters such as heat waves, floods, firestorms, and wildflowers, as well as indirect impacts through air pollution, disaster patterns, undernutrition, displacement, mental illness, and violent risk. Vulnerable groups are affected more than others, such as women, children, older adults, Indigenous peoples, people with disability, and other marginalized communities. Health systems need to be resilient for these upcoming impacts. For these reasons, ICN developed our position statement on climate change. The health sector is not above these problems and actually can contribute to them. Climate change is driven by greenhouse gas emissions from humans, and the healthcare sector has been stated to have as high as 4% of those global emissions. The main contributors are energy use, product transport, and product manufacturing. The goal is to have zero admissions by 2025, and nurses can lead in that change at the bedside through mitigation and adaptation efforts. It's also important to note that climate change is closely related to social justice. The climate crisis worsens existing health and social justice inequalities. Women and girls are disproportionately affected due to their roles in caregiving, resource access, and increased violent risk. We need to end fossil fuel dependence and transition to more sustainable systems that could save more lives annually. Climate justice must integrate with health justice and social justice. At the end of ICN's position statement, we gave recommendations for what we believe is needed for next steps. Each nurse should take these into their own lives. So first, nurses must lead and support sustainable practices in healthcare facilities. This means getting involved with your hospital's healthcare committee on climate change, or finding a way to get involved with your government's leading efforts on climate change and reminding them that health facilities are part of those climate change efforts. Next is about mitigation and adaptation. Nurses must engage in policymaking for mitigation and adaptation. We already have the effects of climate change underway. The first goal is to mitigate those. Just like in nursing at the bedside, we want to prevent first, and then treat the acute illnesses and tertiary illnesses later. It's the same thing with climate change. However, prevention isn't always possible since some of these changes have already started. So it's important to make sure that we are adapting to the new world of a warmer world or a drier world or whatever specific climate change is happening in the area in which you live, work, and play. We need to, as nurses, make sure we're addressing the most vulnerable groups first. Working at the bedside, we can see that certain groups are more impacted by policies and inequalities of the world than others. And ample research suggests that these inequalities are only going to grow as climate change continues. So as nurses, we need to make sure that any climate policy we create has those most vulnerable groups at the center of it. We need to make sure that our nursing education and practice has sustainable methods. As I mentioned 2 slides ago, healthcare systems are not above these impacts and greenhouse gas emissions and other sorts of pollutants that the healthcare system can cause. We need to make sure that our healthcare systems lead an example for other industries in their green practices. Finally, as I mentioned as a theme of this as well, the best way to advance is to partner together so that we're not doing anything alone. And the Alliance for Nurses for Healthy Environments is a perfect example of multiple groups partnering around the world. In our position statement, we gave specific calls to governments as well as individual nurses. At a governmental level, we call for people to adhere to the Paris Agreement and work towards fossil fuel phase out. At a governmental level and a global health organization level, we also call people to fund climate resilient communities and health systems and to promote active transport, sustainable housing, and plant-based diets. Those goals can feel really big to us individual nurses, but that doesn't mean we still can't be part of the solution. We can unite together to advocate at the global governance level. However, as individual nurses, we can also educate ourselves, peers, and patients about climate impacts. We can advocate for sustainable policies and waste reduction. We can lead renewable energy transitions in workplaces, and we can build communities' resilience through local and inclusive strategies. As I mentioned, we didn't have just one, but we had 2 important documents come out on climate change and planetary health this year. In 2025, we published a topic brief, which is an overview and deep dive on a certain subject. This topic brief was on nursing for planetary health and well-being. Let's get into what that document discussed as well. For those of you that don't know the definition of planetary health, it is a solution-oriented, transdisciplinary field linking human health to the health of the Earth and natural systems. It overlaps heavily with climate change, which is why I wanted to talk about it today in context of our climate change position statement. And I know from your title, you're used to looking beyond just climate change to environments in general. And that's the core premise of planetary health, that we're not limiting ourselves to climate change, but we're looking at the health and well-being of the Earth, the environment, and its ecosystems. Major drivers of poor planetary health are climate change, pollution of both air, water, and land, loss of biodiversity, deforestation, and resource scarcity. It is very important that we address these things now because we're facing many issues in climate change and pollution. And these things can threaten the stability of our Earth's ecosystems. It is estimated by the World Health Organization that there is greater than 13 million preventable deaths caused per year because of environmental causes. That is an incredibly high number and highlights how we as nurses should be thinking about this in every day, no matter where we work within the healthcare system. Nursing is a really important element to this, and our topic brief took the time to really explain that. Health and environment are inseparable. Air, water, food, and biodiversity all directly impact health. Nursing is the largest and most trusted healthcare profession. It influences patient care, community action, and policy. We have an ethical duty based on that code of ethics I mentioned on the second slide to protect our environment and advocate for sustainable practices. Education and advocacy are really important tools that we can use. We also can build up our disaster preparedness, response, and resilience, and we can make sure we have sustainable healthcare work practices. Our topic brief covered the Planetary Health Education Framework. This framework has 5 different domains. First, it's an interconnection within nature. Humans are part of nature, not separate. Second, it's an Anthropocene and health. This understands human-driven environmental change. Next, it's the importance of equity and social justice. We discussed this with our position statement as well. It's important to protect vulnerable populations and future generations. Next, the movement, building, and systems change. It's important to have collective action for sustainable future. Those partnerships I talked about before. And finally, we need system thinking and complexity, holistic problem solving, something we know nurses are good at because of our work at the bedside. Nursing, the position or the topic brief on planetary health had actions that nurses can take at the end of it. Some of these actions include reducing healthcare waste and carbon footprint, providing local sustainable foods at every facility, making sure there's renewable energy and eco-friendly procurement of foods. Nurses can also lead environmental stewardship, teach adaptation and resilience strategies, and integrate Indigenous knowledge and traditions into their care and practice. Moving forward, nurses, planetary health is essential for human well-being. Nurses must be champions of both prevention and adaptation strategies. And collaboration across disciplines and culture is critical. Every nursing role can embed environmental sustainability within it. So, across our talk today, I would like to leave you all with the 3 different roles that you can get involved in order to impact climate change and health in a positive way wherever you work. These 3 categories are advocacy, sustainable work practices, and adaptation. So first is advocacy. There are a lot of things that we as nurses are not in direct control over. However, we have a voice. And advocacy is the process of using those voices, hopefully together, partnered with other like-minded people, to impact global decision makers in a way that best suits the health and well-being of the planet and our patients. So the health sector and nurses need to advocate for the elimination of fossil fuels and push for cleaner energy sources. We also need to advocate for climate, that climate and health are interconnected, and that health workers can champion policies that reduce environmental harm and provide public health. The health sector, excuse me, the health sector and nurses' voices are powerful in both local platforms in pushing for environmental justice. I bring up the justice again because as nurses, we see the injustices in how climate is affecting different communities. And it is critical that as nurses, we use our voice to make sure those policies don't just prepare for climate change, but also are able to address it in a way that affects all different communities. It is also important for nurses to have sustainable work practices. Nurses and healthcare leaders can advocate for sustainability in hospitals and healthcare systems. We can focus on reducing carbon footprints in healthcare and promote effective energy, waste reduction, and sustainable practices. Hospitals have large environmental impacts, and nurses can be part of leading the change in making for greener and more eco-conscious healthcare systems. We mentioned that 4% carbon footprint coming from the healthcare sector. And regardless of where you work and practice in the world, I'm sure you've seen the amount of healthcare waste we put out and how much it takes for the healthcare system to stay running and afloat and how wasteful those practices might be. We need to put patients' health and well-being first, but we often use that as an excuse to not address the core high carbon foot and not green initiatives within our healthcare system. With creativity and innovation, there are ways to make the healthcare system greener if we prioritize it, while still keeping patients safe and delivering high quality care. Finally, and what is unfortunately becoming one of the most important steps here, is adaptation and preparing for climate realities. Climate change is already here. We have already seen the impacts of climate change, and there are more disasters happening every year. We've already seen mass migrations of individuals due to climate change in certain areas. Nurses are at the front lines of the world and the impacts of climate change, and therefore they need to be ready to adapt for a new climate world. The health sector needs to prepare for increased disease burden, extreme weather disasters, a rise in conflicts, and changing environmental conditions. Health workers must be educated and equipped with knowledge on the health impacts of climate change to provide better care for a changing world. We can't just sit around and hope that just through our advocacy alone, that the leaders of the world will stand up and listen to us and do the right thing. Because unfortunately, over the last 50 years since we've been raising these more environmental issues, we haven't seen many leaders of the world step up and make changes. We're not going to sit around and wait for those things. We're going to keep advocating, but we also need to make sure that we prepare for the adaptations. If there's going to be more hurricanes in Caribbean island states, we need to have disaster plans in place so that we know what to do when they come in. If there's going to be more floods in a certain area, we need to know what's going to happen when a flood comes in. If there's going to be a rise in communicable diseases due to increased heats, we need to know what to do as nurses. And this is something in our skill set that we can have the power to do right in our healthcare systems without waiting on anyone else to change their mind. Health workers and nurses are the solution. So I really want to leave you all with a message today of believing in yourselves and believing that you have the ability to make small incremental changes until they add up to a big one. And at the Alliance for Nurses for Healthy Environments, I know that you all are already taking those steps. You're already working together across borders and already having joint advocacy. So I definitely want to take a moment to commend all of your efforts and the progress that you've already made. I'll leave you with a few other ways you can get involved with ICN in the coming months. We invite you all to our Advanced Nursing Practice Conference in Tennessee next fall. Abstract are already open, so please come to our website and take a look at that. We should have plenty of things on the agenda related to climate change and environmental health. We also just finished our Congress in Helsinki, and that was a great success. And we invite you to keep an eye out for our advertisements for our next Congress in 2027 in Taipei. And with that, that's all I have for you today. I'll leave you with this quote: "Nurses, above all things, require to be united. By union alone, can be the necessary strength be obtained." Thank you. Gracias. And I'd like to give special thanks to the authors of our topic brief, Dr. Teddy Porter, and the position statement, Erica Burton. Thank you. And this is a pre-recorded message, but I will be on your call live tomorrow, and I'll be taking your questions then. Muchas gracias a todos.